Good evening and welcome to the second Inside Government Show for the fall 2020 semester here at Cuddy Community College. This is the show that is shown on Spectrum, Verizon, Fios, as well as ARMA, the Auburn Regional Media Access, as well as broadcast on WIN 89.1, the college's radio station on Saturday mornings. I'm your host, Guy Cosentino. Due to the COVID-19 worldwide pandemic, our show has changed a bit since we stopped filming in March. In fact, I think the guest we have today was almost our last guest last time, back in the spring. But we are delighted to be back in the studio for this semester with new health protocols, both from the county and from SUNY directives. We're doing one show per taping versus doing an Inside Government and Beyond the Front Page the same day and broadcasting. We do one on Tuesday, one Thursday, and then we're taping and putting them out. This also includes only allowing one guest in the studio at a time because our guest usually brings somebody with a specialty from her office in. But just a reminder that this is a college production. Students direct, produce, and tape these shows. And we're front-loading the schedule starting in early September rather than in late September or October. And going to December will end just after Election Day. And she is also our final guest as well. With all that in mind, it is important to discuss what is going on with the local response to COVID-19, specifically from the county. And we are delighted to have in the studio Kathleen Cuddy, the county's public health director, to give us an update. I should say is welcome back, first of all.
Thank you.
We are following protocols. We came in with our masks. We are not using cups that everybody uses. We have bottles of water that we might sip from time to time, but welcome back.
Thank you, Guy. You made me feel very special. I feel
well, you are. You are. I mean,
well,
last year we started a series on public health, and we were doing every single month, and then COVID kind of got in the way. So before getting into COVID, how are you doing?
Well, aren't you nice to ask? Doing okay. I wouldn't cry if I had a vacation, but I'm sure a number of people feel similarly, and I'm in the fortunate position, to be busy and have a job, and I don't take that for granted. I will say, if I didn't work with the wonderful people I do, and I cannot say enough great things about the people at the Cuddy County Health Department, all the employees there, completely stepped up, do extra, go the extra mile. They're incredible people and work so hard, and it makes my job immensely easier, along with the other people and partners I get to work with.
So I know your mom. I've known your mom since I think I was before one. How is she dealing with this? Because she's, she's out there, and you have boys, both here locally and at college. How are they all dealing with it?
Well, I think that's a good point to make, that all of us who work in public health and healthcare, we have families also, and we have family members who are in high-risk groups. We have family members who are out and about doing things. Fortunately, they're all doing well. And they are very conscientious, I think, not only because of the work that I do and bring information home, but because they are paying attention and they want to do their part to help reduce any transmission and prevent getting ill.
So it's seeping
so far
through.
It's good. I like to think so.
Occasionally, as I'm talking to myself in the kitchen, they're understanding that. So at this stage, and I know I just got an alert about a Wasco school, which we'll talk about in a second, is how many cases do we have in the county?
You would ask that question, and I did not bring my sheet with me. I want to say there's at least 184 as of today. There might be another one to add to that. So as of yesterday's press release, we had 184 in total.
Since March, let's say 13th.
We started tracking in March.
And how many of those are roughly active cases right now?
I believe there are 5 active cases, but I think we'll be adding one more to that list today as well.
And are they mainly in the city? Or are they outside the city?
They are all over the place. As I look at my data that I brought one of the maps that we share, right now the most singular number of cases are within the city, which kind of goes with the population, but that's only a percentage, right? That's maybe a third or even less. Actually, it's probably a quarter of the cases that we've had throughout the county. So
but that's since March, but there was a little bit of a buzz earlier in the year, or in the pandemic, and I shouldn't say the year, though it does feel like 20 years since March, that some of the cases were in southern Cuddy County. There were clusters, because you were giving out by town that these might be migrant workers, not necessarily in their workplace, but in living conditions, they were clustered, and they, for whatever reason, they're clustered, and they might have tried their best washing their hands, not touching their face or their eyes and things like that. But were there clusters there, and are we still having clusters in the migrant community, which is a big part of the economy here in Cayuga County?
It is a big part of our economy, and I think that's something that kind of rose to everyone's consciousness, you know.
In a good way.
In a good way, because it's a more vulnerable population within our community that often is not given the notice. You know, the people who do that work are not given the notice. We absolutely have seen our most number of cases initially through essential workers, of which our migrant population were among them, working in agricultural industry. And because they are migrants, they have, I'll call it more temporary housing, oftentimes, which may be living communally, it may be living in a hotel that is converted for migrant housing, it may be living in individual homes that are owned by the company.
So we are having clusters there.
We definitely did have outbreaks related to some work settings in that regard.
Has that improved?
I believe it has. I don't believe, I know that it has improved. Okay. But it still goes on. I will say one of the silver linings related to the essential workers, particularly migrant workers, is it really built stronger the relationship that our health department had with these work sites. Agricultural farms, dairy farms, you know, crops aside from. There are workers who are immigrants, laborers who may not be considered migrant who come in to do work in a factory. And that has definitely strengthened our relationship. And it's really
and that's gone over on the other side of Syracuse. That's what's happened there, where there have been some outbreaks.
You are correct.
Okay.
We're really pleased that the owners of these businesses, as well as the people who work there, want to do the right thing, because their operations are going to suffer. So from a business point of view, it's the smart thing. But from a human point of view, we've really seen they want to do the right thing also.
And do you have an idea of what our positivity rate is at this stage? Do we test enough in the, maybe this is a different question. You had some concerns that were publicly aired about that we weren't testing enough because we weren't getting supplies. First of all, are we testing enough or satisfactory? And I know that's two different things. Enough would be 100%. Are we doing enough satisfactory as far as you're concerned, and are you getting the resources you need from upper government, whether it's Albany or Washington?
So that's not the simple answer it should be. Right? I say that, I could say yes, because we do have supplies right now. We do have the ability to test. And our partners, we've worked very closely with the hospitals and the urgent care centers and healthcare providers. We've got the testing supplies to do a nasopharyngeal test and ship it away to the laboratory. And at this point in time, 3 to 4 days is typically the timeline we can get the return.
And so is that the only type of testing we're doing right now?
That is the only type that's being done in Cayuga County, unless you are in the hospital and are an emergent patient with particular needs, and they have the ability to do some limited rapid testing. So when I say is there enough testing, I can also say no, there's not enough testing. So I would love to see rapid testing be in our community. It's not here yet. And
is it in Onondaga at this stage?
They're developing it. Upstate is very cutting edge, right?
And they'll be doing it here on this campus, I believe, either next Monday or the Monday after. We're going to do samples.
That's exactly.
And President Durant will be here in 2 weeks to explain that.
I'm really pleased that this is rolling out. Is it as sensitive? If for surveillance tools, it's ideal. If we need to analyze because you're symptomatic, it's probably not the best at the moment, but it will always continue to improve. And we have other options outside the county.
But 3 days to 4 days to get results is a long time.
It's a long time if you're symptomatic. So if you have the ability to go out of county to be tested, Upstate has a quick turnaround. Cayuga Medical Associates in Ithaca has a quick turnaround, and we encourage people to go there to be tested if
Is
necessary.
it because Albany's not sending you the resources? Where's the hiccup?
I've heard different things. So with our hospital, they need reagent, and they can't get enough reagent.
There's not enough reagent nationally. It's not just
There's
local.
not enough locally.
Okay.
I'm hearing that there are limitations to what is available nationally, but also, and I will say somewhat appropriately, reagents are being sent to the higher incidence areas.
Right.
So
If you had a
if
hot spot,
you have a hot spot, you need to test more to try to contain it. And we've been very
biker
fortunate in upstate New
communities
York.
that most likely should not have had conventions. I'm not asking you to comment on that, but I will say that. So with that, do you have an idea how many tests you're doing a day? We have a population, let's say, between 70 and 80,000 people. How many tests are you doing a day?
I can't tell you that today. I can look that up and see what's coming in as results, because we don't always hear if a test is given. We only for sure get the results that are given. Now, some of the dashboard work that's being done now for schools is going to give a better sense of who's being tested and negative results. We'll get results from a test. It may be one that took 3 or 4 days. It may be one that was a 24-hour turnaround.
And are you set up for contact tracing? I mean, that's the next, forget the whole 3 to 4 days, but say you do find, and I'm going to go back to Owasco in just a second,
Sure.
but if you are, do you have the resources to do, and are you set up for contact tracing right now?
So we are set up for contact tracing. We've been doing that right along.
And how is that funded? Is that just out of your general budget, or are you getting special aid from Washington or Albany to pay for this?
I feel like you're walking me through the door, because there's a lot I can share right here. There's a lot that's changing in that regard. So typically it's our public health nurses that perform our contact tracing, and that's who's been doing it since day one. But the state has heard our concerns, and the federal government, I think, hears it as well. And we have just recently been offered the opportunity for some additional grant funding to offset some costs to increase our contact tracing ability. So we are in the process of accepting those funds, and we will look to hire on some additional staff to help us with our contact tracing. With that comes learning and being part of a new statewide system called ComCare, so that we can do things locally, but we share more readily our data with the state. It's more real-time sharing.
So I mentioned a couple minutes ago the whole idea of our positivity rate locally. So I think the state is under its whatever number of weeks now under 1%.
Right.
Central New York is had a spike up to closer to 2%. I think it's a little bit lower now. Is that largely due to the outbreaks, for example, up at Oswego? Is that how our number jumps? Because you haven't had other hot spots, to the best of my knowledge. Am I correct?
To the best of my knowledge, we haven't. Of late, it has been more university-related activity.
So as we were walking down here, because I have to meet you at the front door, I have to walk you into the studio, which is no problem because we have a nice chat. We got a health alert from the Auburn School District that even though they don't have children in the school right now, they have had a case where somebody may have had tested positive for COVID. Am I correct on that?
You are correct on that.
So what can you tell us about how you identified it, what's going on, and what's the plan?
So it was identified from a lab result. An individual was tested. We received the lab results. They were positive. We start the process by following up with that individual to make certain they're aware of their lab results. As part of that, then we start the contact tracing immediately, and it's learning, what does this person do? Where have they been? Do they have a job? So in this case, it's an employee of the Auburn School District who happened to be an employee at Owasco Elementary School. Because of the phased-in approach that I'm sure the superintendent will speak about when he has his opportunity, very limited number of students who are in the school at this point in time. So then we talk to that person and say, who have you been in contact with? Who have you been closer than 6 feet for more than 10 minutes without your face cover? And then we take it from there. And we go back, not just for the days that that individual spent at work, but they have people that they may interact with outside of work.
How much work is that?
It's a lot of work. It takes a lot of conversation. It takes a lot of skilled conversation to elicit replies. And you have to be a really good listener also, because someone may say something that triggers, they may have gone to their in-laws' house. Let's talk about that and not for you. So
Okay.
the conversations.
So at this stage, you believe that at least in that particular case, you've identified and you've started the contact tracing process, I'm assuming, today or before?
Immediately. We started immediately, and it was wonderful. In this case, the individual had great recall for where they've been during their infectious days, and it's been very helpful.
So they'll self-quarantine?
They will be in isolation.
Isolation.
We call it mandatory isolation.
So how do you check on them?
We check on our mandatory isolation people on a daily basis.
Somebody
We-
physically go to their
Yes.
living abode?
So we do a combination. We do a telephone call and we do drive-bys is how we refer to them. So
We're not
because
putting ankle bracelets on them, but
No.
you want to know that they're staying.
we want to know they've restricted their movements and who they interact with. We don't want them going out in public. They need to stay home. We want them to try and keep their distance from their household members also, because if their household members are not ill, you want to try and help prevent that.
So of the 140 cases, we don't have to pin it down to a specific number, have you had people who have not followed?
There have been some people who need some additional prompting to stay at home.
Oh, you sound like a mom of boys. So how do you prompt them?
We talk about the consequences. So first we start with, if we become aware of the
Don't
fact.
be stupid.
Pretty much play on their humanity, right? And you don't want to make other people sick, and most
Right.
people don't. There may be a reason why I needed to go pick up my groceries from the store, and they had drive-bys. No, we'll help coordinate that for you. Do
There's
not
Instacart,
leave your
there's all
home.
types of other,
There's alternatives, right? So that's what we start. And then as part of being in isolation or mandatory quarantine, there's legal documents that accompany that order. And so there are,
because this is a public health crisis.
it is a public health emergency. These are public health orders, so that if you violate these orders, there are consequences.
So we have been, and I don't mean to minimize this, we've only had 3 deaths, which I think is
Thank goodness.
remarkable. Do you think that, I just think, as we've seen, I think we've passed the 200,000 mark in the nation. I am surprised Cuyahoga County has such a low number. Is that because we've done, you and the state have done a great job with social distancing? Is it because we haven't identified people, or is we're checking everything out on every death and this is it?
I think it's
And I don't
all
want to
of those
minimize
things.
that 3 people lost
Not
their
at
lives.
all. It's incredibly unfortunate. I think it's all of the points that you made. We're a low-density population. That certainly helps. People have been doing their part to try and be preventive and restrict their movement, use their physical barriers, wash their hands. I think people were very anxious at first. That level of anxiety in the population is waning a little bit.
Are you worried about that?
And that's concerning if people aren't maintaining their preventive behaviors. And that means don't go to large gatherings. And I think there may be it's okay. We're fine. We're all related. We have people who are positive who go to the family picnic or go to the backyard party.
Or they're asymptomatic and you don't
and
know
they're
that.
asymptomatic and such.
So of the deaths that you've had, has there been a commonality, or are these people with pre-existing conditions? We talked about that a few minutes ago.
These particular deaths, and because fortunately it's been a very low number, I am aware that each of those circumstances there were additional health issues that likely contributed.
So I want to talk about Albany and Washington, and not the political side of it. How do you think Albany, as a general, from a public health perspective, has handled the crisis?
I think there's been good communication, and I'm not playing the political fence on this either, but I think the fact that the governor gave routine updates was really helpful for a lot of people. We've had amazing assistance from our State Health Association in facilitating regular phone calls with the State Department of Health multiple times a week. There's a lot of education that goes out unilaterally that speaks to some of the statistics and the percentages, but there's also an opportunity for local health departments to get together and say, this can be better if. And the boots on the ground need to be heard.
Right. How about the response from Washington when it's come to whether it's PPE or other items that you need, testing kits and whatnot? How is Washington as far? Again, I'm not talking about the administration or the president. I'm talking about Washington in general is the behemoth.
I'm disappointed. For example, what I was aware of for the Federal Strategic National Stockpile and assets that are there, they are to be triggered when there is a need within states and localities. and PPE is the primary example.
So are you getting what you need?
Right now, we do have what we need, but there is a
But originally,
backlog.
yeah.
We absolutely did not have enough PPE, and if we have to do mass testing or if there's a mass outbreak, we need more.
So don't pin me down this, but if I remember correctly, it was either you or Aileen McNabb Coleman who'd said, you put in an order for X and you got 60% of what you needed, but it wasn't what the primary items are on there, correct?
Correct.
So we got about 10 minutes left. I'm just telling that to the control room so they know. What is the policy locally when it comes to nursing home visits? Just a couple of real quickie questions on those, because I want to talk about the flu as well.
So the nursing homes still have a restriction in their visitation, I think, unless there's end-of-life concerns. But some of them are really trying to assess what's appropriate. The hospital is doing the same thing.
And what about, is there a mandate on masks locally?
There is, and thank you for bringing that up. So there's an executive order from the state that mandates use of masks in
So
stores.
there's a state
and
mandate.
Yes, so it's a state law, and it needs to be upheld.
So this is my concern. I'm not going to talk about a grocery store in the center of the city of Auburn, but I know they had a sign I thought I read there where it's required, but there's nobody necessarily, to the best of my knowledge, and I don't know this and I don't want to get them in trouble, but they want you to wear a mask, but they may not be telling you to wear a mask. Who enforces whether it's a business, a store, a restaurant? Is that?
It falls to the health department.
But
and
you have to
we're
get a
doing it.
complaint on that.
That is how we are making our steps forward when we receive the complaint. So there's a way you can complain to the state through a hotline, and that's actually a really great way to do it because
And
it's
are
recorded.
people locally?
Oh, yes.
Okay.
Yes, that's a large part of the time we spend in education is listening to people and then talking to places where there may be violations of the mask order. And we've been doing follow-up consent orders, and we'll have some hearings in the near future about violations of that executive order.
So I want to finish up on the vaccines and the flu. Just in a quick summary, and I know Dr. Fauci and everybody else at CDC, what is in your mind, the timeline once a flu vaccine is developed to roll out so that you and I and every student here can get it?
The flu vaccine or the
I'm sorry,
COVID vaccine?
the COVID vaccine.
So they have to finish doing their
So let's
pilot
say
testing.
hypothetically they do it and they miraculously get it on November 1st.
Okay.
What do you think? I've been told you're looking at the spring and the summer before it gets mass distribution. Is that what you're thinking?
Yes, it will take some time to create enough in order to distribute it, and not just to have the vaccine, but then to have the supplies. You need the syringes to
Right.
administer that vaccine. Once we have it as a locality, we can move pretty quickly.
And so your office will distribute it as well? You do the flu vaccine, or flu, and we'll talk about that in a second. Do you think there will be a mandate, at least for students, whether it comes, well, first of all, do you think there will be a mandate for students to get this vaccine like you would require for smallpox or the measles?
That's $1 million question. I think that's being
But
tossed
you see
about
that
locally.
coming from Albany, not...
It's being discussed currently. It's being discussed currently about having a mandate for flu vaccine, which exists. So if
So there is a mandate for flu?
depending where you go, right?
Okay.
Depending
So if you're
what your
in
work
Cuyahoga
is.
County right now, do you have to get a flu?
You do not, but we strongly encourage you to do so.
And we have anti-vaxxers out there. So forget the whole election thing. Again, I
Right.
want to stay away from that. Do you ever worry that you're going to have this whole slew of people? Again, there's some criticism because there is an election, and people keep tossing out stupidly November 1st because of November 3rd.
Right.
Do you ever worry that people are just not going to get it because you got anti-vaxxers, but you also have some who say, I'm not really sure that this was sped up by the CDC and these companies because there was an election. What's your worry on that front?
We absolutely want to make sure that these have gone through the proper trials before they're administered publicly.
Okay. And I know right now as we're talking, I have a 8-year-old who is likely down at the health department getting a flu shot, a flu nasal, because he doesn't do well with needles. Mm-hmm. Do you see a nasal spray, or do you think that's going to be some time for the COVID-19? Because you're talking about a lot of kids who don't like needles.
Correct. And
you have a lot of adults, by the way, too.
I'd like to say I'm skilled enough in that level of detail. I know the nasal spray is a kind of a live-based virus, so I don't know if that has something to do with the way that it's administered versus the killed version. I think any manner in which we can provide it, whether it's through a shot, through a spray, what a great thing.
When can people start getting the flu shot?
Right now.
And your office is offering them?
We are offering them, pharmacies offer them, doctors' offices offer them. We aren't looking for business. We're there to provide. If you want to get your flu shot at the pharmacy because that's convenient and you can get it Saturday afternoon, go ahead and get it.
Why should somebody get the flu shot?
Well, first, you don't want to get the flu because there are a lot of complicating issues that come with the symptoms of flu. But even more so this year because of COVID, we know that the symptoms of flu and the symptoms of COVID are so similar, and we don't want to spread flu to other people. We don't want to spread COVID to other people. And even if the vaccine just diminishes some of your symptoms, it's a good thing.
So the vaccine for flu is not always 100%
correct.
Effective, but it does reduce complications and the impact of the flu. Am I correct on that?
You are correct.
And you want them to get it because of the COVID-19 issue. You have a strong group of senior citizens out there, I know one of them, who have not always gotten the flu shot. What would be your case to them?
You're more vulnerable. The older we get, the more vulnerable we are to the effects of the disease. You don't want to get flu. You don't want to get COVID. And the actions we take to reduce flu are good for us. The physical actions we do to help reduce COVID will also help with reduce flu spread as well.
Do we know how effective? I know I thought it was somewhere between roughly 60% last year's effectiveness of the flu vaccine. Was that roughly?
That sounds about right. Okay. But don't quote me. I'd have to go back and ask.
So my last question for you, and I'll put this in the nicest way. So I'm doing an interview. I did an interview the other day for the Wednesday morning roundtable, and Neil O'Brien, who's the superintendent of schools for Port Byron, said to me, I said, what worries you? He said, the one thing I don't want is Kathleen Cuddy's number popping up on my phone.
I'm okay with that.
Okay. But you get it.
I don't want to be doing that.
And he was being nice. He couldn't say enough nice things about you and your staff, but he said, that's my worry. What's your worry?
A mass outbreak and not having the ability to test or control it, because it's going to get then to the populations who've been doing what they can to not get ill, right? So we want to prevent. That is the number one. And
do you think, forget the worry, do you think we're going to have an uptick as, we're going to have 3,000 or 4,000 Auburn students go back to school in the next month? That's the largest school population here. We're going to have people go, the weather's going to turn at some point. We're going to have lousy days and people are going to be inside. Is that your worry, is that we're going to have a resurgence this fall?
It is a concern that as groups gather back together that we're going to see increases in cases, yes.
Well, I hope I don't see you, I hope I see you outside of here, but I hope I don't see you in the studio, because if I do before November 5th, that means we have a problem. Right. So, but you will be back with us on November 5th to give us an update on where we are.
Thank you.
And we really appreciate all the work you're doing, but also for taking the time to give an explanation of what's going on with the health department and COVID-19.
Well, thank you, Guy. We appreciate the opportunity.
So our guest has been Kathleen Cuddy, the Cuyahoga County's Public Health Director. She's been here to talk about where we are on COVID-19, and like I said, we hope that we'll be back. We'll still be here on November 5th with classes and a show, and we'll have her back then. On Thursday, we will be hearing from Auburn Superintendent of Schools, Jeff Perazzola. He'll talk to us about the Auburn schools. We will ask him about what's going on at Owasco. As we said earlier today, there was a news notice about that. We'll also talk about the hybrid system of learning that the district is going to be dealing with. Next week, we will have Cuyahoga County Sheriff Brian Skank in to talk about his presentation this week. in regards to social justice and law enforcement. We'll also have Cuyahoga County Legislator Trish Kerr on next Thursday to talk about the local census efforts. You have until, believe it or not, with all this that's going on about COVID-19, we need you to fill out the census. And you have until Wednesday, the 30th of September for that nationally. So we encourage you to do that. In the coming weeks, we'll also have an update from City Manager Jeff Dygert, as well as the Cuyahoga County United Ways 2020 campaign. We have started to invite the candidates in here for forums. We have heard back from Ms. Balter, who will be in the studio. We're waiting to hear back from John Katko, the incumbent for the 24th Congressional District. We have both candidates agreeing on the 51st Senate District, which is now held by Senator Seward, who is retiring and who will hopefully be here at the end of the semester as well. We're waiting to hear back from the candidates for the 50th Senate District as well as the 126th. We have heard from one of the candidates, Mr. Lamondes, who is seeking to replace Assemblyman Gary D. Finch. And then we will also have the candidates for the 130th Assembly District. I will moderate those forums, and Jeremy Boyer, the executive editor of The Citizen, will, as usual, ask the questions. Before we go, though, we would like to let you know that you can send us your thoughts and future guests or questions for those guests to Inside Government, COZGUYTHO@AOL.com, or Inside Government, 141 Dunning Avenue, Auburn, New York, 13021. I'm Guy Cosentino for Cuyahoga Community College. We want to thank you for watching. We hope you're safe out there. We hope you have a good night and a great tomorrow, and we will see you back in the studio on Thursday with Superintendent of Schools Jeff Perazzola.